Welcome back to another Deep Dive Med. You know, it's amazing how interconnected our body systems truly are.
Right.
And for this deep dive, we're really going to need to keep that big picture view in mind.
Yeah, definitely.
So, for example, we often focus on the heart and the lungs when we're talking about respiratory issues. But did you know that the kidneys also play a crucial role?
Oh, absolutely. Yeah. They're often overlooked, but they're super important.
Yeah, and all of our sources really emphasize how vital the kidneys are.
Yeah.
They're like the body's master regulators.
Right.
Keeping fluids balanced, ensuring the right acid-base levels, and making sure electrolytes are in check.
That's a big job.
Yeah.
It really is.
All of this directly impacts how well your heart functions.
Exactly. Imagine the heart as a powerful pump.
Okay.
And when someone has heart failure, that pump weakens.
Right.
And it can't deliver blood as effectively to the rest of the body, including the kidneys.
Oh,
This reduced blood flow means less oxygen for the kidneys,
I see.
which makes it harder for them to filter waste and maintain that critical fluid balance.
So it's like a domino effect, right?
It is.
Heart failure leads to kidney problems, which then worsen the heart's ability to do its job.
Yeah,
It creates this vicious cycle.
precisely. And you might see this cycle manifest in different ways.
Okay.
Like swelling in the legs or even the lungs.
Wow.
In some cases, the heart itself can become enlarged
Really?
because it's working so hard.
So I know diuretics are often used to help with fluid retention,
Right.
but one of our sources pointed out that they might not be as effective if the kidneys are already struggling.
Yeah, that's true.
It's a bit like trying to squeeze water from a stone.
Yeah.
If the kidneys aren't functioning properly,
Uh-huh.
diuretics won't be the magic bullet.
That's a great point, and it raises a critical question.
What's that?
What happens when medications alone aren't enough?
Right?
In severe cases of kidney failure, dialysis might become necessary.
Okay.
Think of it as giving the kidneys a helping hand.
Yeah.
The blood is filtered externally to remove excess fluid and waste products,
Okay.
allowing the body to maintain a healthy balance.
That's pretty intense.
It is.
But it really highlights just how crucial the kidneys are
Right.
in the grand scheme of things,
Yeah, absolutely.
especially when we're talking about respiratory health and heart function.
Yeah. Now let's shift gears a bit and zoom in on how medications directly interact with the heart.
Okay.
You can think of it as having three main levers:
Okay.
chronotropic,
Okay.
inotropic,
Uh-huh.
and dromotropic effects.
Okay, so this is where things get interesting. Chronotropic drugs. Think of a chronograph like a stopwatch.
Oh, okay.
They affect how fast or slow the heart beats.
Right.
It's all about the heart rate.
Exactly. And then you have inotropic drugs.
Okay.
These are like a personal trainer for your heart,
Huh.
influencing how strongly it contracts with each beat.
Oh.
They play a vital role in managing things like blood pressure and stroke volume,
Okay.
how much blood the heart pumps out with each squeeze.
So chronotropic is about speed,
Mm-hmm.
and inotropic is about strength.
Exactly.
Got it.
And finally, we have dromotropic drugs, which affect the heart's rhythm.
Okay.
It's like the conductor of an orchestra, making sure everything is in sync.
A perfect analogy.
Now, to understand these effects better, we need to zoom in on the heart structure.
Okay.
Specifically, the right and left ventricles, each with its own important job.
Right. The right ventricle is responsible for pumping blood to the lungs
Yep.
to pick up oxygen,
Uh-huh.
while the left ventricle sends that freshly oxygenated blood out to the rest of the body.
Right.
It's a beautiful synchronized dance.
Exactly. And this is where the concept of pulmonary hypertension comes into play.
Oh, okay.
Imagine a traffic jam in the blood vessels of your lungs.
Okay.
This increased pressure in the pulmonary arteries
Uh-huh.
makes it much harder for the right ventricle to pump blood,
Oh, wow.
leading to a backup and strain on that side of the heart.
And that strain can eventually lead to a condition called cor pulmonale,
Right.
essentially right-sided heart failure.
Mm-hmm.
We also see a connection to elevated CVP pressure,
Yeah.
which reflects the increased pressure building up in the right atrium because of that blood backup.
Now let's shift our focus to the heart's electrical system, which is controlled by the SA node,
Okay.
the heart's natural pacemaker.
Uh-huh.
If you think of the SA node as the conductor of the heart's orchestra,
Okay.
sometimes that conductor needs a little help
Right.
keeping the rhythm steady, and that's where meditations or even pacemakers can step in.
So it's important to differentiate between two main types of arrhythmias.
Right, supraventricular means above the ventricles.
Okay.
So these arrhythmias originate in the atria.
Got it.
And You have some common examples like atrial fibrillation, which causes a chaotic, irregular heartbeat.
Okay.
Atrial flutter, which is a bit more organized but still too fast. And supraventricular tachycardia, or SVT, where the heart suddenly races.
And then we have ventricular arrhythmias.
Yes.
Which, as the name suggests, originate in the ventricles.
Right.
These can be much more serious.
They can be.
And include ventricular fibrillation,
Yeah.
which is a life-threatening chaotic rhythm, and ventricular tachycardia,
Right.
a rapid heartbeat originating in the ventricles.
Exactly.
There's also a unique type called torsades de pointe,
Oh, yeah.
which has a very distinctive wavy pattern on an ECG
It does.
and is often treated with magnesium.
Our sources highlighted adenosine as a medication used to treat SVT.
Oh, okay.
It acts like a circuit breaker, briefly interrupting the electrical signals that are causing the rapid heartbeat, allowing the heart to reset and regain a normal rhythm.
Fascinating stuff.
It is.
Now let's dive a little deeper
Okay.
and explore the microscopic world of cardiac cells.
Right.
Did you know that these cells have specific receptors?
They do.
Kind of like doorways that respond to different signals, including medications.
Exactly. And one crucial distinction to remember
Okay.
is the difference between beta-1 and beta-2 receptors.
Okay.
Beta-1 receptors are primarily found in the heart, while beta-2 receptors are mainly in the lungs.
Okay.
This means that medications targeting beta-1 receptors will have a much more focused effect on the heart itself.
So it's like having a targeted delivery system for medications,
Yeah, you could say that.
ensuring they go exactly where they're needed.
Right.
And when those beta-1 receptors are activated, they trigger the fight or flight response, which, as you might guess, increases heart rate.
That's right.
It's amazing how these tiny receptors play such a huge role in regulating how our heart functions.
Absolutely. And it's not just receptors at play here.
What else is there?
Other ions, like calcium, sodium, and potassium, also have a major influence on the heart's electrical conduction system, making it even more intricate.
Wow. So we've talked about how medications can affect heart rate and rhythm.
Right.
But what about blood vessels themselves?
Oh, that's a good question.
That's where vasodilators come in, right?
Exactly. Vasodilators are like relaxation gurus for your blood vessels,
Oh, okay.
working on those beta-1 receptors to widen and relax the blood vessels,
I see.
which can reduce pressure in the system and make it easier for the heart to pump.
So it's like taking the resistance out of the equation.
Yeah, you could say that.
By lowering that resistance, the left ventricle doesn't have to work as hard to push blood out to the body.
Right.
We call this reducing the afterload.
Now, one of our sources mentioned a condition called refractory hypoxemia,
Okay.
which is a situation where someone's blood oxygen levels remain dangerously low, even when they're given supplemental oxygen. It's a bit like trying to fill a leaky bucket.
I see.
You keep pouring in oxygen, but it's not getting to where it needs to go.
That sounds pretty serious.
It is.
And I remember from one of the articles we read that this ties into the concept of refractory periods in cellular activity.
Right.
It's almost as if the cells need a brief time out
Yeah,
before they can respond to more oxygen.
precisely. And it's a critical concept to understand,
It is.
especially when dealing with respiratory diseases where oxygen levels are a primary concern.
Absolutely. Now, before we move on to specific medications, I think it would be helpful to touch on ECG interpretation.
Sure.
Since we've been talking about the heart's electrical activity,
Right.
and ECG tracing is like a roadmap of the heart's electrical cycle,
It is.
with those squiggly lines telling a story
Yeah,
about what's happening in each heartbeat.
absolutely.
Right.
The P wave is when the atria contract.
Uh-huh.
The QRS complex is the big spike when the ventricles contract.
Oh,
And the T wave shows the ventricles relaxing and getting ready for the next beat.
it's amazing how much information we can get from those little squiggles.
It is.
It's like having a window into the heart's inner workings.
Now that we have a better understanding of the heart's structure, electrical system, and how medications can interact with it, let's explore some specific medications and their mechanisms of action.
Okay.
Are you ready to delve into the world of pharmacology?
Absolutely. This is where the rubber meets the road. Let's do it. First up, we have digoxin, which has a fascinating history. It's actually derived from the foxglove plant
Oh, wow.
and has been used medicinally for centuries.
Really?
What makes digoxin so special is its ability to make the heart's contractions stronger.
Uh-huh.
It does this by influencing how calcium is handled within heart cells, ultimately leading to a more powerful pump.
It's amazing how nature provides us with such powerful tools for medicine.
It is.
And speaking of powerful tools, let's move on to some first-line treatments for heart failure.
Yep.
ACE inhibitors and beta blockers.
Yeah.
You've probably heard of these.
I have.
And they're both incredibly important in managing this condition.
Right. ACE inhibitors work by relaxing and widening your blood vessels.
Exactly.
Remember how we talked about afterload,
Mm-hmm.
the resistance the heart has to pump against?
Yeah.
Well, ACE inhibitors help reduce that afterload,
Right.
making it easier for the heart to do its job.
It's like taking the weight off the heart's shoulders, so to speak.
I like that.
Beta blockers, on the other hand, take a slightly different approach.
Okay.
They work by blocking the effects of adrenaline on the heart.
Uh-huh.
You know that feeling of your heart racing when you're stressed or excited?
Oh, yeah.
Beta blockers help to calm that down, slowing the heart rate and lowering blood pressure.
So it's like putting the brakes on the heart a little bit,
Yeah.
helping it to beat more efficiently.
Exactly.
And the sources mentioned that beta blockers are typically used in stable systolic heart failure.
Right.
It's important to use them strategically and under the guidance of a healthcare professional.
Absolutely. Now, beyond ACE inhibitors and beta blockers, we also have other vasodilators in our toolkit,
Okay. Like what?
like hydrolysine and nitrates, which can be used in specific situations to help relax those blood vessels and improve blood flow.
And I remember from one of the articles that dobutamine is another medication that's used to increase the heart's contractility.
Oh, yeah, that's a good one.
So if someone has very low blood pressure,
Uh-huh.
dobutamine can give their heart that extra boost it needs to pump more effectively.
Exactly. It's like giving the heart a little jolt of energy.
Yeah.
And then, of course, we can't forget about nitroglycerin,
Right.
the classic medication for chest pain.
Uh-huh.
It's often given sublingually, which means it dissolves into the tongue for quick absorption.
I've heard it described as working like dynamite for your blood vessels,
Oh, wow.
quickly widening them to restore blood flow to the heart muscle.
That's a good analogy.
And in the case of a heart attack, that quick action can be life-saving.
Absolutely. The goal is to get that blood flowing back to the heart muscle as quickly as possible
Right.
to prevent damage.
And if a heart attack does occur, another important medication that might be used is Plavix,
Oh, right.
a blood thinner that helps to prevent clot formation.
Yeah.
Remember how we talked about those electrical signals in the heart getting disrupted?
Uh-huh.
Well, during a heart attack, those disruptions can lead to blood clots forming,
Right.
which can further block blood flow and worsen the damage.
Exactly. So Plavix helps to keep those blood vessels clear
Okay.
and allows the heart to start healing.
And one of the sources emphasized the importance of preserving left ventricular function during a heart attack.
That's a crucial point. The left ventricle is the powerhouse of the heart, responsible for pumping oxygenated blood to the entire body.
Uh-huh.
If it's damaged, the body doesn't get the oxygen it needs, which can lead to a whole cascade of problems.
So protecting the left ventricle is paramount
It is.
in ensuring someone's recovery and long-term health.
Absolutely.
Now let's shift gears for a bit and talk about diabetes,
Okay.
which was one of the key topics on our outline.
Right?
It might seem a bit unrelated at first,
Yeah.
but diabetes can have a huge impact on cardiovascular health.
Absolutely. And it all comes down to understanding the two main types of diabetes,
Okay.
type 1 and type 2.
Uh-huh.
Type 1 diabetes typically develops in childhood
Okay.
and is thought to be an autoimmune condition where the body attacks the cells in the pancreas that produce insulin.
So in type 1 diabetes, the body essentially can't make its own insulin.
Right.
And insulin is crucial because it's like a key that unlocks the doors of our cells,
Uh-huh.
allowing glucose or sugar to enter and be used for energy.
Yeah.
Without insulin, glucose builds up in the bloodstream, leading to all sorts of problems.
Exactly. It's like having a key that doesn't fit the lock. The glucose can't get into the cells where it's needed.
Type 2 diabetes, on the other hand, is a bit more complex.
It is.
It usually develops later in life
Uh-huh.
and is often linked to lifestyle factors like obesity and inactivity.
Right.
In type 2 diabetes, the body can still produce insulin, but the cells become resistant to it.
So it's like the lock has become rusty.
I see.
The key doesn't turn as easily, and glucose has a hard time getting into the cells.
And this resistance to insulin can lead to chronically high blood sugar levels,
Yeah.
which can damage blood vessels and increase the risk of heart disease, stroke, and other complications.
You got it. And that's why managing blood sugar levels is so critical.
It is.
In both types of diabetes,
Uh-huh.
regular monitoring medication and lifestyle changes can all play a role in keeping blood sugar levels within a healthy range
Right.
and reducing the risk of complications.
So we've covered a lot of ground here, from the intricate workings of the heart and the impact of various medications
We have.
to the complexities of diabetes and its cardiovascular implications.
It's clear that these topics are interconnected in some really important ways.
Absolutely. And one of the things that really stands out to me
Yeah.
is how important it is to understand the why behind the what.
Okay.
When you understand the mechanisms of action of different medications, how they work on a cellular level,
Right.
you can start to see those connections and apply that knowledge more effectively in clinical practice.
I completely agree. It's not just about memorizing drug names and dosages.
No, it's not.
It's about connecting the dots, understanding the underlying physiology, and seeing how everything fits together.
Exactly. And as you continue your studies, I encourage you to ask those why questions.
Okay.
Dig deeper, explore those connections, and don't be afraid to challenge assumptions.
Right.
The more you understand, the better equipped you'll be to provide safe and effective care to your patients.
It's like becoming a detective for the human body, right?
Yeah.
You gather the clues, you analyze the evidence, and you
right.
use your knowledge to solve the puzzle.
Of how to best help each patient.
That's a great way to put it. And as you continue to learn and grow in your understanding of pharmacology,
Yeah.
remember that this field is constantly evolving. New discoveries are being made all the time,
Oh, wow.
leading to new treatments and improved outcomes for patients.
So it's a lifelong journey of learning and discovery,
It is.
which is exciting.
Very much so.
Now, before we wrap up this deep dive,
Right.
I want to make sure we highlight a few key takeaways for you.
Right, I'm ready.
First and foremost, never underestimate the power of lifelong learning.
Right.
Pharmacology is not a stagnant field. It's dynamic and constantly evolving. Stay curious.
Yeah.
Keep asking questions.
Uh-huh.
And embrace those opportunities to expand your knowledge.
I couldn't agree more. And the second takeaway I want to emphasize is the importance of critical thinking.
Okay.
Don't just take information at face value.
Mm-hmm.
Analyze it,
Uh-huh.
question it,
Yeah.
and apply it to real-world scenarios.
Right.
Think about how different medications interact with each other,
Yep.
how they might affect different patients differently, and how you can use your knowledge to make informed decisions about treatment.
Those are fantastic points. It's about connecting the dots, seeing the bigger picture, and using your knowledge to provide the best possible care for your patients.
Exactly.
And speaking of patients, that brings me to our final takeaway for today.
Oh, okay. What's that?
Never lose sight of the human element in all of this.
Right.
Pharmacology at its core is about people.
Uh-huh.
It's about using our knowledge and skills to improve the health and well-being of others.
It is.
Approach your studies, your practice, and your interactions with patients with compassion, empathy, and a genuine desire to make a difference in their lives.
Beautifully said. I think that's a perfect note to end on.
And that's a wrap on this deep dive. Don't forget to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.